Nerves. Published by WordPress.com. Median nerve injury, anatomy, course, and clinical presentation. Root values. C5, C6, C7, C8, T1, originating from both the lateral and medial chords of the brachial plexus. Origin and termination. Origin: medial root, medial chord. Lateral root, lateral chord. Termination: at the distal flexor retinaculum where the nerve divides into medial branch, lateral branch. Course of the median nerve. 1. Axilla, upper arm. Travels lateral to the brachial artery. 2. Middle arm. Crosses from lateral to medial across the brachial artery. 3. Lower arm. Continues medial to the brachial artery. 4. Cubital fossa. Passes between the two heads of the pronator teres. 5. Forearm. Travels along the midline between the flexor digitorum superficialis, FDS, and flexor digitorum profundus, FDP. 6. Wrist. At about 5 cm above the wrist, it becomes superficial between the flexor carpi radialis, FCR, and palmaris longus. And 7. At the wrist. Passes deep to the flexor retinaculum. Median nerve branches and function. Lateral branch. Motor. Innervates the three thenar muscles, abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and the first lumbrical muscle. Sensory. Provides sensation to the lateral 2/3 of the palm and the palmar aspect of the lateral 3½ fingers. Medial branch. Motor. Innervates the second lumbrical and provides motor function to the remaining lateral 3½ fingers. Sensory. Provides sensation to the palmar cutaneous nerve for the lateral 2/3 of the palm. Mode of injury and effects. 1. Cut injury at the wrist, and carpal tunnel syndrome. Sensory. Loss of sensation on the palmar aspect of the lateral 3½ fingers and the lateral 2/3 of the palm. Motor. Weakness or paralysis of the three thenar muscles and the first lumbrical. Deformity. Ape hand deformity, flattening of the thenar eminence, hyperextension of the thumb, and adduction of the thumb. 2. Pronator teres syndrome. Sensory. Loss of sensation in the lateral 3 fingers and lateral 2/3 of the palm. Motor. Weakness in the pronator teres, flexor carpi radialis, FCR, flexor digitorum superficialis, FDS, palmaris longus, and lateral half of the FDP. Deformity. Pistol hand deformity, with difficulty pronating the forearm. 3. Benediction sign. Motor. Inability to flex the middle and index fingers at the MCP joints due to paralysis of the flexor digitorum superficialis and flexor digitorum profundus. Deformity. The hand takes on a benediction posture where the index and middle fingers are held extended while the ring and little fingers are flexed. And 4. Anterior interosseous nerve injury. Motor. Weakness or paralysis in the flexor pollicis longus, FPL, lateral half of the flexor digitorum profundus, FDP, and pronator quadratus. Effect. Difficulty flexing the distal phalanx of the thumb and index fingers, leading to difficulty forming a pinch grasp. Clinical tests for median nerve injury. Tinel's sign. Percussion over the carpal tunnel to elicit tingling or shock-like sensations in the median nerve distribution. Phelan's test. Forced wrist flexion for 30 to 60 seconds to reproduce symptoms of carpal tunnel syndrome. Reverse Phelan's test. Extension of the wrist to reproduce symptoms of carpal tunnel syndrome. Treatment and management. Conservative. Splinting or immobilization to prevent further nerve damage. Anti-inflammatory medications and physical therapy to address weakness and function. Surgical. Decompression of the median nerve at the carpal tunnel in cases of severe compression. Nerve repair or tendon transfers for long-standing paralysis or deformities.